Welcome to another evening of Food Literacy for All. We have our second panel this evening on a subject of great interest to all of us, food policy and health outcomes. Before we get started, before I introduce Lily, who will introduce the panel, just a couple of brief announcements. Just again, a thank you to the sponsors of the entire series from both within and without the university. And then an announcement of a series of events that are happening through this week that are in a sense related to some of the topics that may come up tonight. The theme of Veg Week at the University of Michigan. From this evening through Friday, there are activities on campus, a whole series of very interesting presentations, films, discussions, dinners, and encourage you to check some of these out. A lot of work has gone into organizing these, and they look really interesting. With that, I would like to turn things over to Lily Fink-Shapiro, one of the course coordinators here, and she will introduce tonight's panel. Thank you.
Great. Thank you, Catherine. You guys hear me all right? Yes, I see some nods. Welcome. We're really thrilled to have our second panel here this evening. And the way this is going to work, so I'm going to introduce each of them, and then we'll hear from each of them, and then we'll kind of have some dialogue, and then we'll open this up for Q&A at the end. And I think when I reflect back on the semester so far, you know, we've had a couple of farmers, we've heard from farmers, we've had a chef here, we've had some authors, we've had activists, but we haven't yet devoted that much time to talking specifically or really examining the food system and how it affects our health. And so I think for a lot of us, when we think about the connection between food and health, we immediately think of nutrition. And we think, yep, food and health equals nutrition. And tonight we're going to try to challenge that a little bit and open it up to what else is food and health about. We're going to talk about policies. We're going to talk about all kinds of issues. And so, of course, nutrition does play a big role in determining our health and diet-related illnesses. But we're also, we're going to talk about health policy, and we're going to talk about food access. And we have three incredible panelists here to join us tonight. I just want to make an announcement. If any of you guys use Twitter, you can join the conversation by tweeting. If you use the hashtag Food Literacy for All, that's another way that you can ask a question. If you can tweet thoughts throughout the evening. So I'm going to first start out. We'll go in this order. I'm going to first introduce Alicia Cohen. Dr. Alicia Cohen is a faculty in family medicine here at University of Michigan. She's a research fellow at the Ann Arbor VA. And she'll discuss a little bit about her work and what she does and what got her into this. Okay, go for it.
So sorry, can you guys hear me okay? Okay, I think we're going to be up here just for the slide clicking and then. So I actually, let me make sure I can, are we doing the questions?
Yeah. Yeah, let's start out with a question. If you read the question, then that's
okay. So we're going to start out with questions. So one of the first questions we had for the group is, which of the following do you think most impacts food access? Do I need to? Okay. Oh, I'm sorry. So A, location, B, customer service, C, price, D, culturally appropriate options, and E, all of the above. Well, I think I think we'll likely be touching on many of these points over the course of the next hour and a half. So, but it's definitely always kind of interesting to kind of get a sense of where folks are in the room. So, I don't know. Is there a right answer? Are we going to come with the right answer?
Maybe we should ask it again at the end and see if anything has changed or if most people.
Oh, I like that idea. Thank you, guys. We're doing this a little on the fly, so appreciate you. Clearly, I did not read the notes about how I was supposed to introduce this. So, all right. So actually, to start, I want to open with a story. And some of you may have heard this story before. And if so, I hope you'll bear with me and agree with me that it's a story that bears repeating. So I actually want to talk about a patient a patient of mine. She's actually one of the first patients that I took care of as a third-year medical student. And we'll call her Shannon. And Shannon was in her early 20s and had very difficult to control diabetes. And she had had multiple hospitalizations for her diabetes in the past several months. We were kind of trying to figure out what was going on and sort of taking care of her blood sugar and then kind of, figuring out how to like patch her up and let her go back into the community, but she kept on ending up back in the hospital. And one of the reasons that Shannon kept on ending up in the hospital is because she didn't have regular access to healthful food and the food she needed, and she also didn't have a reliable place to store her insulin, to refrigerate her insulin. And one of the reasons that she didn't have reliable food access or access to her insulin is that she didn't have stable housing. And one of the reasons that she didn't have stable housing is because she wasn't able to get regular work. And one of the reasons that she wasn't able to get regular work is because she kept on ending up in the hospital. And so as a med student, and even so now, I was so struck by watching this cycle repeat itself over and over again with Shannon and other people I was caring for, and seeing the ways in which as a healthcare system, we were completely ineffective at being able to actually address some of the root causes of what was impacting people's health, and being able to really address the concrete needs that we needed to address in order to be able to care for them. And so now much of my work is focused on how we can do a better job of identifying and addressing some of these unmet needs, which are sometimes called the social determinants of health. So I kind of look at that broadly, and then specifically, much of my work focuses on food insecurity, which is what I want to talk with you more about tonight. And so first, just sort of recognizing that there's a lot of different folks in the room, I kind of want to take a step back and kind of define what exactly is food insecurity, because I feel like, that's kind of a buzzword that gets bandied around. So there's a lot of different definitions that people will use. One definition, that's a definition used by the USDA, is limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. So just kind of letting that sink in for a moment. And again, there's lots of other definitions that people will use for sort of what it means to be food insecure or to have adequate food access. And so just sort of thinking about how common food insecurity is. So thankfully, food insecurity nationally has been getting better over the past couple of years, but still nationally about 1 in 7 US households and about 1 in 5 households with children, or almost 1 in 5 households with children reported being food insecure at some point in the last year. In Michigan, we're doing slightly better than the national average, but those numbers are still pretty profound. And then I want to draw your attention to the fact that right here in Washtenaw County, even though again, these numbers are slightly better than the national average or Michigan as a whole, this still translates to almost 50,000 families in Washtenaw County who are struggling with food insecurity. And then looking at Wayne County, which Alex and Winona are also going to be talking more specifically about Detroit, the numbers are more than 1 in 5 families are struggling with food insecurity. So I think that this is an issue that is much more prevalent than many of us tend to think about. And so thinking about what are some of the ways to potentially help address food insecurity, SNAP, which is the Supplemental Nutrition Assistance Program, formerly known as food stamps, is the largest federal food assistance program in the US. And SNAP has been shown to help address food insecurity. But many families still struggle to afford nutritionally adequate foods, particularly because healthful food is often much more expensive than sort of the calorie-dense, nutrient-poor junk food that is often much cheaper. And so we could talk about that for a very long time, but one promising initiative that people have used to try to address this financial barrier to healthful food our SNAP incentive programs, which basically allow for people when they go to farmers markets and for some of the programs increasingly with grocery stores and corner stores, they can have their money doubled to spend on fruits and vegetables. So recognizing that financial barriers are only one barrier to food access, there's certainly a barrier that looms large for a lot of folks. And so this is a way to try to help address that gap. And in Michigan, we're really lucky to have the Double Up Food Bucks program, which is one of the most established SNAP incentive programs in the country. It's accepted at over 250 farmers markets and grocery stores throughout Michigan. Their model is also now spread to over 23 states across the country. However, and there's been research to show that when people use SNAP incentive programs, that this definitely is associated with both increased purchase of fruits and vegetables and also increased consumption of fruits and vegetables. But one of the things we found is that one of the major barriers to people using incentive programs is that a lot of people don't know about it. They don't know about the programs, they don't know that they're eligible for the programs, they don't know how to use the programs. So, as a family doc, kind of one of the things, and it's interesting because sometimes people are like, wait, you're a doctor? Like, what does it have to do with food? Which actually makes me really sad because I feel like being a doctor has everything to do with food. And so we decided to do this project, study at the Ypsilanti Health Center, where we just said, you know what, let's see if we can. We know that lack of knowledge about Double Up Food Bucks is a major issue. And when I talked to providers and staff at the Ypsilanti Health Center, they didn't know about the Double Up Food Bucks program. So they were saying, well, we're not telling people about it because we didn't even know it existed. And when I talked to social workers about it, they said, well, of course we know about it. And if people come to our office, we tell them about it. But if people don't get referred to us so that we can do the screen, then we can't give them that information. So there was this huge disconnect. So we said, what if we ended up surveying about 800 people in the waiting room of the Ypsilanti Health Center. We found almost half of them were SNAP enrolled. Of that, and that doesn't include people who may have been eligible for SNAP, but weren't able to get access to SNAP, which can happen for a lot of reasons. It's administratively very difficult to actually enroll in SNAP. But of those, we also found that 85% of the patients in the waiting room that we surveyed said that they had been struggling with food insecurity at least some point in the last year. And talking to providers in the waiting room, or talking to providers at the health center, people kind of said, we knew that food insecurity was an issue. We knew that people are really struggling, but we had no idea that the numbers were that high. And so in terms of the study, what we did is there were 177 people, and we basically just said, did you know this program, Double Up Food Bucks, existed? Did you know that you're eligible for it? Here's a map with all of the farmers market locations and hours in the area. And then we gave people a $10 voucher just to get them started. Because in case people hadn't been to the farmers market before, just kind of like an additional incentive, because obviously it's time out of your day and transportation issues to be able to get there. And then we surveyed people 4 times over the next 5 months to basically find out, if they use the program, how often they use the program, and then we looked at fruit and vegetable consumption and also talked to them about their experiences. So very briefly, what we found is that at the beginning of the study, 18% of people had said they had used Double Up before. 3 months later, after literally all we did was give them information and a map and this $10 voucher, 69% of people had used the program at least once, and 34% of people had used the program 3 or more times. And we found that there were significant increases in fruit and vegetable consumption, almost 2/3 of a serving a day of fruits and vegetables. And we found that the more people used Double Up Food Bucks, the more their fruit and vegetable consumption increased. So this is just like, a small window. Again, there's lots of the pieces of the puzzle that we have to tackle, and this is some like itty bitty piece of it. But I think some of the things that were really important to me and kind of why this is a piece of my work I like to talk about is thinking, about the potential for using the waiting room to deliver educational interventions. And sort of when people are spending valuable time kind of waiting to see a provider, why don't we actually use this time in a way that can actually help them? Rather than like offering people, totally out-of-date magazines that often have all the interesting articles already torn out of them. And I think the other thing is we need to understand how to address the barriers to using Double Up Food Bucks, some of the people who didn't use it. Because talking to people, everybody wanted to use it. It was a way to double your money. Why wouldn't you want, and also talking to people were really, really driven to improve their diets and to eat more fruits and vegetables. And we're talking about, all of the health reasons in which they wanted to make their health better. They wanted to improve the health of their families. They wanted a better life for their children. And so they wanted to be eating better. Lack of knowledge that eating fruits and vegetables was good for them, did not come into the equation. People don't need to be told that. It's a question of how we can actually increase access. And so for people who wanted to use Double Up but weren't able to, what are some of those barriers and how can we address it? And I think the last piece is, what are some opportunities for clinics to address unmet need through connection with existing community resources? So rather than sort of saying, we need to reinvent the wheel and figure out how we can address all of these issues, how do we actually look to community organizations and community resources that have been doing this for a really long time and are doing it really well and are doing it better than we're going to be able to? And instead of putting in the resources into trying to sort of create co-located assistance to try to help people, what if we actually put those resources instead into breaking down silos and to being able to facilitate and foster communication and collaboration between health centers and community resources? So I could talk a lot longer, but I'll stop there.
Great, thank you so much, Alicia. That's really helpful to kind of get a clap for her. I think that's really helpful to get an overview about food insecurity and food access issues in general, and you gave us some statistics about food insecurity both in this country and then in Washtenaw County and in Michigan. And then I think from there we'll even zoom in a little bit more, and we'll turn to, I want to introduce Alex Hill, who's going to talk specifically about food access and food insecurity in Detroit, in the city of Detroit. So Alex works at the City of Detroit Health Department, and he's the Chronic Disease and Injury Prevention Manager, which, as he says, includes the food system, and he has a position that allows him to do a lot of work in food access in Detroit. So let's welcome Alex.
Oh, did I turn this on? Can you hear me? Yes? No? No one's shaking their head?
Yes.
Is that better?
Yeah, you're good.
All right. Awesome. Who loves maps? More hands. Yes. Okay. So I'm going to talk about a bunch of maps and take you through a little bit more of, well, not my day-to-day because that's not that exciting, but kind of some things that fall under my purview. Oops. Do I need to? Question. I knew there was a question coming up. All right. Next question. Do I need to hit something to make it go? Or it goes by itself. All right. When people shop for food, people being you all, how often do they talk with people at the grocery store? So A, always, B, sometimes, or C, never. Ooh, B, sometimes. So we're kind of right there in the middle. So, we don't have the, what is it, the Amazon Go store where your phone just picks up, your phone's tracking your every move so it knows exactly what you picked up off the shelf or put back. We don't have any of those yet. So in most cases, you need to talk to at least someone. But now we've got the U-Scan, self-checkout. You don't need to talk to anybody sometimes unless you really want to. But in Detroit, that's not an option. There are no self-scan checkouts in Detroit. You have to talk to somebody when you go to buy your food at a grocery store. So before working for the Detroit Health Department, I was doing a bunch of research with Wayne State University. And one thing we did in 2014 was ask people what they felt their own access to food was, and kind of their perceptions around it, their experiences. And across the city, what people talked about most was community service. So they lacked good service in many of the places where they went to shop, both inside the city, outside the city, when they were just getting some fruits and vegetables, when they were doing a full shopping trip. To the point where there was one community in Detroit that was excited when their grocery store closed because the store owner treated them so poorly. I guess that's something to think about, food access. we often talk about distance and how far away the grocery store is. Do you have a car? Can you get there? But there's a whole lot more that goes into that. And most often, people want to feel good about where they shop for their food. And I always try to talk about a healthier city begins with food. I think we all know, food lays the base for a good health. And when we're looking at that, we think about life expectancy. So this is a common metric that the health department uses to measure how well the city is doing. In the United States, dying before age 70 is considered early death. And so in the city of Detroit, we have a lot of work to do. There's a lot of people that are facing a lot of chronic conditions related to food and many other things that are causing life expectancy to be shorter across the city. And we also see that food is really important. Poor diet, this is looking globally, but poor diet generates a bigger non-communicable disease burden than tobacco, alcohol, and physical activity combined. So if you're not getting the good food that you need, likely the rest of your health is going to fall apart. How many people have seen this guy? Where's my public health people? Oh, not too many of you. All right. Yes. So if we think about what goes into our health, often we're talking about, so as I said, we're talking about the distance to the grocery store, what's in your food environment, but mostly that ends up being about 10%. Healthcare goes into about 20%, so your access to care, the quality of care. Next is health behaviors, so that's your own personal choices, what you're doing, where you're going, what you're eating. We have less control over what you choose to do. And then 40% of that, nearly half, is going to be those socioeconomic factors. So income, education, job, etc. And if we break that out to the larger, so for you public health people, socio-ecological model, right? So we've got our person in the middle. Influencing those individual behaviors is going to be super difficult. We don't have kind of mind control options yet, not that we want them. Family and community is going to be your next closest opportunity for things that influence your health. Next is that healthcare system, a little bit further out. And then generally, where we see a lot of public health interventions and activities is in this largest circle, the physical environment, because that's the easiest for places like city government to get to and to make changes in. And so our big goal at the health department is reducing risk. We've got kind of three main buckets where we're looking at reducing risk. The biggest one is diet. So there's a lot of things within the diet that we're hoping to improve. Environment, also important. So under injury prevention are things like traffic accidents and fatalities, other things like poor air quality. So you're not about to go be active in your neighborhood if the street signs aren't protecting you, or the air quality is so bad that you don't want to be walking around. And then, so that takes us to chronic disease. So here's our maps, right? All you excited map people. So we've got obesity rates across the city. This is from the CDC's 500 Cities project, if you wanted to look that up later. So we get down to the census tract level to be able to look at the distribution, estimated distribution of obesity in the city. So you can see there are some pockets. Similarly with diabetes in the city. And then if we, oh, nope, I don't have that slide. Oh, whoops, sorry. I thought there was one more slide. And so we have this, we're talking about grocery stores, access in the food environment. Detroit's oddly, number 2 food industry is fast food. We have a lot of different locations. Coney Island gets its own shout out, as well as Detroit, if anyone's, Detroit pizza. So I think Detroit is home to the most, what's it called? Like headquarters for pizza companies in the nation, with Buddy's Pizza, Little Caesars. What's the other one I'm thinking of? I don't know. There's lots of pizza. Actually, the number one industry in the city of Detroit, the number one food industry, I'll say, is the snack food and beverage industry. So if you enjoy Better Made chips or Faygo, you're supporting the Detroit food industry. And then I know Alicia talked about food insecurity. So this is a food insecurity index that Forgotten Harvest put together. I don't know if I completely agree with their methodology, but it does give, it shows those highlighted areas in the city where there could be areas to focus. And if you don't know Detroit, many of these areas that are a little bit darker are also areas where population is more dense in the city. So where there are more people, there is more food insecurity. Oh, there's the other map that I was thinking. So if you think back to life expectancy in the city, that's based on mortality rates. And if we specifically pull out the diet-related mortality, so things related to diabetes, obesity, and heart disease, the vast majority of these are related to heart disease. We can also see that kind of spatial pattern in the city where we might be able to pull together some programming and intervention to reduce those rates. And so this slide is my job. The top 7 causes of death in the city of Detroit are related to chronic disease and injury, with number 1 being up there, heart disease, number 2, cancer, number 3, unintentional injuries, which that includes motor vehicle, stroke, chronic lower respiratory disease, diabetes, and kidney disease. Ooh, purple, that's fun. And so if we look at the numbers, I don't generally like to throw a bunch of numbers into a table and say, look at these, but look at these. The numbers largely have not changed in about the last decade. So the chronic disease burden in Detroit has not shifted basically whatsoever. This is starting to get really depressing because these are all the things that I'm going to be working on changing. All right, that's all I got. Thank you all.
Great, thank you so much, Alex. And next I want to introduce Winona Bynum, and I'll introduce you in a couple of ways. So first of all, Winona is a registered dietitian. She has a background in nutrition. And she's also the executive director of the Detroit Food Policy Council. And I also, will give a shout out here to the Food Policy Council, and also the Food Policy Council, as some of you probably know, are some of our core community partners for this class throughout the semester. So often, although Winona's not always here on Tuesday nights, often a lot of our speakers participate in events in Detroit either before or after they come to class. And so Winona is often on the organizing and receiving end in Detroit of this class. So with that, I'll welcome you up.
Thank you. Okay, I have to ask a question. Can you hear me? Everybody's asked that. Okay. Okay, so I'll talk more about the work that we do at the Food Policy Council. Well, actually, Lily and I, we were all talking before this, and she asked me to share a little vignette about how I got into this work and how I became a registered dietitian. So my first career was in IT. I was a programmer, and then a software development project manager, and ultimately a worked in the program office. But during that time, as you may probably guess, as an IT professional, I kept crazy hours, and I ate crazy too. So just, really unconventional eating, chips for breakfast, that type of thing. Nobody ever talked to me about my eating because I didn't have any weight issues at that time, and that's all we think about, right? How a person looks. But anyway, started to feel bad and went to the doctor. They just offered medical interventions, but I had a wonderful manager who said, you eat like crap. You might want to look at that. And so I did, and I slowly changed my eating habits, and it was like magic, like, what? I eat an apple and I feel better? Like, this is crazy. So when I got a chance to learn the science of it, so I made a career change and I got a chance to go back to school and learn the science of why that happens. So dietetics is really a science curriculum. Everybody always asks me, oh, you like to cook? I actually do, but that has nothing to do with dietetics. We had one class on making sure that the food tastes okay. The rest of the classes are about the science of it and what the molecules do when they get in your body, no matter how they taste. But so when I was in school, I got to work in the community. As an IT professional, I really was more, I was around corporate people. I didn't think about like what I needed to do to get my food. So I would go out to the suburbs because I had a nice car, I had the money to do so. But when I started to work in the community, I realized that this nutrition information that I wanted to share, it didn't make a lot of sense if the people I was talking to, my community members, didn't have the environment that supported putting the health advice I was given into play. And so slowly I changed my work, and that's how I got into policy work, because I want to see an environment where not only me, where I had the ability to do the work around, but people who don't have that ability have the environment that supports a healthy lifestyle. So what is a food policy council? It is not something that we just made up. It is actually a thing. And this is some of the work that food policy councils do. The real big thing is the convening. So as you'll see, I have a slide in here about how we're set up. But the thing is that you bring people from different backgrounds and they get to talk around a table and make things happen. They get to talk to one another, because usually we're in our own silos. So if you're a nutrition professional, you're talking to other nutrition professionals. If you are an urban farmer or a farmer, you're talking to other farmers. But this is a place where people can talk around a table and make things happen. And so here's a definition. I won't read it to you, but. So the environment that we work in, there are more than, the last count, 324 food policy councils around the USA and Canada. So that affords us at the Detroit Food Policy Council a network. We're loosely networked. We have a listserv. We talk to one another. If we run into issues, if somebody is working on something in DC, I can call them and say, hey, this is working out. How did that work? And we can talk and bring that to our local area. There are also 20 food policies, around 20 food policy councils in Michigan. And we're also networked. So we have a monthly call where, again, we talk and we look at issues that we may have in common. So sometimes if there's an issue in an urban area like ours, it could be happening in a rural area too. We may have that same problem. Or like a lot of times, so there was an ordinance that was state level, and they thought, okay, this is a good idea. But as we started to talk, it really would impact some harm on a lot of local areas. But we were able to talk through that and actually go to the state representatives and bring up our concerns as a united voice. And here I just have the Directory of Food Policy Council, so you can go out there and we have our contact information if you are moving somewhere else or you wonder if in your area there's one. But the Detroit Food Policy Council is unique in that most food policy councils come about through health, like a health department saying it's needed or a government official saying it's needed. But the Detroit Food Policy Council actually came through community action. So the Detroit Black Community Food Security Network, Malik's organization, was instrumental in getting first a food security policy written that was adopted by the city of Detroit. And next, that food security policy actually called for the formation of a food policy council. That was, it was supported by then council member Joanne Watson, and it was adopted through resolution unanimously in 2008, and we started meeting in 2009. And we hired our first employee. The first employee was hired in 2011. Our structure, I talked a little bit about this, like the 21 council members. So there are 4 staff, but we couldn't get much done just as 4 people. But really what makes us unique are those 21 people around the table. Are you in this, Malik? This is an old picture. The 21 people around the table really make this unique. We have representatives from the health department, of which Alex is our health department representative, representative from city council, and the mayor's office as well. And then we have the 13 members, community members, so those 4 at-large members are community members who may not be working in a food-related job, but they are interested in the food environment in their community. And then we have a youth member. We get our work done through committees or work groups, and so we meet monthly there. This is our mission. We are actually going through strategic planning. So our mission, as you can see, what we want to look at is not just access, because everybody always talks about access, which is important. However, also being able to not just be a consumer, but engage in the economics and actually shape your food system is very important. So we also have that in our mission. We're going through strategic planning right now, and we're working also equity. So equity is also, as you can see from our values, has always been a core factor, but we want to put it in our mission so that it is never forgotten. But our values: justice, respect, integrity, inclusion, and transparency. So some of our policy achievements. 2008, getting that food security policy adopted, that was huge. So the city of Detroit has a food security policy. 2013, we supported the urban agriculture ordinance, and it was adopted. And before that, it wasn't, so agriculture in the city wasn't a recognized legal activity. Now it is a recognized legal activity, meaning that people can obtain land for that purpose. They can grow fruits and vegetables and actually sell them, which was not illegal. It wasn't illegal, but it wasn't a legal activity before that. We've done voters' guides. I don't have this on here, but we've done food system reports. And we had just partnered with the health department to do another food metrics report. Again, getting those baseline numbers so that we can make sure that we're moving the needle, or what we need to do to move the needle, or where we need to focus our work. And then 2015, 2016, we went back out, and the food security policy that had been originally written, we looked at what had been accomplished, what had changed. We went and did listening sessions across the city, sent out surveys, and then we updated it with that information. And that was adopted, the updated version was adopted by resolution in 2017. So this is us in the community. One of the big things that we do is we make policy. When people hear policy, when I say policy, people glaze over. So we try to make it where it's accessible and really get the community's voice, as well as make sure that the community knows policies that may be impacting them. Like right now, it's a federal bill, but the farm bill is in play. And so a lot of times when people hear farm bill, they really don't think that that has anything to do with them in the city, but it does. There are a lot of programs outside of farming that are under that farm bill. One of them is SNAP, so 80% of that is SNAP. And so you see, we're at farmers markets, we're at conferences. I'm always saying we're trying to put food on the table. So wherever people are not talking about food, we're trying to turn the conversation to show how food connects. We started an awards, so again, recognizing, lifting up what is going well and doing well in a city. So we have an annual award ceremony. We had our third one this past year. We just last week had our food summit. We had our 8th annual food summit. So bringing, again, people from different areas, a lot of community members, people working in the food system, policy folks, again, bringing them in a big room, talking through things, working on workshops, and that kind of thing. And this is not an exhaustive list at all, but we get a lot of our work done through coalitions and partnering. So this is just some of the people that we partner with. Again, with those 21 council members and 4 people, we can only get so much done. But one of the things that the Food Policy Council does is connect areas and bring those voices where they may not have been. So this is my last slide. Okay, so this is my question. I get to. No, I didn't. I didn't give it. If I did give it, did you write it down? No. So, in the upcoming Farm Bill legislation, how many programs are not funded? Oh yeah, and I'm on my way to DC. I have to catch a flight tonight to DC. Yeah. We'll be doing. We don't lobby, so we'll be doing legislation, education, and meeting. It's a national group, the Good Food for All group, that we meet together. So, are people voting? What? You got it right. There are 39 that are unfunded. So if, and some of the coolest programs, like we talked about the program funding Double Up Food Bucks, they don't have funding. So there will be a fight to get those programs funded. The community food projects. So I have the whole list, and I'll make sure Lily gets it or Mariah gets it, so that if anybody's interested. Okay.
Okay, thanks so much. Now, I think we're just going to have a discussion here. I have some questions, and then we'll open it up to you guys, too, to ask some questions here at the end. But one thing that comes up repeatedly when I've talked to anybody about healthy food access and why do we have such a high prevalence of so many diet-related illnesses in this country, a lot of people say, I hear all the time, people say, well, people just don't know what to eat. And I already heard a couple of you touch on this in your intros. But I want to know what you think of that. Do you think that's true? People don't know what to eat? Are there other issues at play? I'd like to hear what you have to say about that.
Okay, I'll start. So no, one of the things that I found, I have had the opportunity to teach a lot of nutrition classes, cooking classes. And one of the things that I found is that there is a lot of information out there. A lot of people have an idea of how to eat healthy. And most of the times it's just that other things don't support it or make that possible. So whenever I teach a nutrition class, I always ask, who has what experience, so I know where to start, and there can be an interchange. So some of the other things that we touched on, like the environment supporting it, being able to get it in a timely manner that fits in with your lifestyle, having appropriate food available, a lot of things.
I can also tell a story. When I moved to Detroit, I started actually as a community health worker on a childhood obesity program. So we were doing in-home skills building with teenagers and their caregivers around, calorie counting, managing hunger and cravings, things like that. And I think it was actually one of the first teenagers that I had to work with. And he, the family was super engaged. They were really interested. The mom also wanted to lose weight and be healthier because she had knee problems and diabetes, and she wanted to be able to maintain her ability to walk. And but because the mom had mobility challenges, they only went grocery shopping once a month, and they relied on the grandmother to come with her car so that they could all do a big trip together. And what ended up happening was, they had limited funds. They could only go once a month. So they had all these calorie-dense foods in the house, and the teen knew that they were only going to be there at the beginning of the month. So he would binge on the food at the beginning of the month, and then by the end of the month they had run out of food until grandma came back and they were able to take the trip to Meyer and use their funds to get more food. And it was just it was a cycle that there wasn't a whole lot that they could change about it. And on the same end, I think we also have to think about traumatic experiences and how that plays into both how people engage with their food and just their everyday activities. So this teen also, he had gone through, he and his friend took the bus to school, and it was about, I think, a month into the program, and his friend had gotten stabbed on the bus. And like I was supposed to check in with him twice a week on if he was counting his calories. That was not the most important thing to this team. Like, he was not going to think about counting his calories for that week. He was thinking about his friend. He was thinking about his neighborhood safety. He was thinking about, so many more things. So.
I don't know. Can kind of add another story
Please.
next. I think a lot of us kind of think in stories and like the people who come to our minds. So I totally agree, and I think that often sort of hearing from people, there's one woman in particular I'm just thinking about where she had diabetes, she had a number of other health problems. And we were sitting and she was crying and saying, I'm trying so hard and I want to be eating better. She was working 3 jobs. She had kids at home. One of the kids had a developmental delay and required a lot of care. Her partner was on disability. And she said, you know what, I'm trying so hard, but when I come home after working a long shift and, I think about sort of what I have in the house and what I could prepare, and then I'm passing by KFC and I know that I can buy, a bucket of chicken and bring it home to my family and it's gonna fill my kids' bellies and it's cheap and it's available. She said it's really, really hard to pass that up. And just thinking about all the stories where you're working multiple jobs, you're spending your time trying to find a job, sort of thinking about, how expensive the food is, but even kind of thinking back to sort of, some of the things where even if you have access to something like Double Up Food Bucks, and which, I think is a phenomenal program, and what happens if you don't have the transportation to get to the places where Double Up Food Bucks is available, or there aren't places where Double Up Food Bucks, or other sort of programs like that, that are within like an easy reach of you, or you can't get there during the hours that they're open, or you don't have childcare coverage. I mean, there's so many things that go into it. But I think also, I remember talking to someone who was saying that in my neighborhood, sort of, I can go to like the local corner store and I can get banana flavored pudding, but I can't get bananas. And so I think that when you're dealing with an environment like that, it's not that people don't know, what they should be eating or how. There's so many other factors, and I think that, when we're having conversations with people, again, kind of, as a clinician, sort of thinking about when you're having a conversation with somebody about, well, these are the things you need to do to be able to change your diet, and sort of all the things that go into that. And one, thinking about what's the advice that we're giving, how many clinicians, how many physicians are actually qualified to give that advice and know what they're talking about. And I would say many do not. And I think many people, by their own admission, say they're not comfortable, which again, I think speaks to a need for education. And then what kind of advice are we giving people? And are we offering culturally appropriate options in terms of recipes and sort of suggestions? And then the other thing is that when somebody tells you, I have $5 to get through the end of the week, that radically changes the conversation. And so I think we just kind of need to take that all into context when we're thinking about what it means to have conversations about nutrition and diet with people.
Mm-hmm. And so to get at this question of, what is it? What are the barriers that communities face in eating a nutritious diet? We've heard, a lot of them have come up. So just to summarize, we've heard about their environments, what stores are accessible to them. Can they get a banana at their corner store kind of thing? We've talked about time. Do they have time to prepare a meal? We've talked about education, right? Do they know what's healthy or not? Which often, it turns out, often the answer is yes. Alex, you brought up the issue of trauma and how that might impact people's eating choices. We talked, obviously, price is a clear contributor. One thing that hasn't come up yet that I'm interested in is what about, and Alex, this could maybe come up in that model that you showed in terms of what are all of the different factors that contribute to, but what do you have to say about marketing forces? Are there other external forces, whether it's even the way that our grocery stores are designed, or billboards, or TV advertisements, or special advertising that food companies might target? What are the marketing forces that might make it harder for us, or would just shape our eating choices?
Well, I know for one, so through the Food Policy Council, we're working on this grocery store coalition with the goal of improving customer service, as was your clicker question. And also ensuring that grocery stores are able to provide and market healthy food options. But one of the biggest barriers is those large corporations. You know, Coca-Cola pays for shelf space, extra shelf space, to put the Coca-Cola on the end cap. And Hostess, you know, they have their specific stand that goes right in the middle when you walk in the store, and you have all these donut options and things like that. So, you know, there's nobody who's coming to the store and doing that for the carrots or doing that for the green peppers or, you know. So I don't know, maybe, so that marketing is a huge, even in the small local store.
And in addition to that, that's completely true. And in addition to that, what's subsidized? So you can get a bottle of soda or a bottle of pop, you know, 2 liters for under $1. That's not unheard of. Whereas 100% juice, because, you know, it's not made of corn, which has subsidies, costs more. So why is that, you know? So then again, that barrier of making it inaccessible to a lot of people. Or even, you know, just plain water costs more a lot of times than soda.
And one other thing I can throw out, there was a researcher in New York, and he was looking at subway advertising, and he and his students kind of looked at all the different subway lines across New York and the different boroughs, Manhattan and the different boroughs, and they were looking at what the advertising was at each train stop. And it was pretty profound. What they found was that kind of across the board, when you were in lower income neighborhoods, it was much more, there were more alcohol ads, there were more basically ads for like all kinds of junk food. And then when you were sort of going into the more affluent areas, suddenly you started seeing ads for like Whole Foods and Gristedes. I mean, he was specifically looking at like food related ads. And it was much more kind of clearly targeting you know, a more affluent area, and so therefore we're going to be sort of targeting a lot of healthier food items, and you know, sort of thinking about all the things that influence us that we don't even realize are influencing us because they're just kind of all around us and they're part of the environment, and it's something we don't even know we're absorbing. And so sort of thinking about those kind of larger structural issues and how they're impacting choice in ways that we may not be aware of at an individual level.
Another topic that comes up when we're talking about healthy foods and promoting healthy foods, and I know there's often, you know, there's cooking classes that sounds like, Winona, you even have some experience with teaching in some ways that may teach people how to make certain healthy recipes on a budget that address some of these issues related to price and time and what's available in their grocery store. My question is, and this comes up, I've heard this as a repeated issue, how do you teach those recipes and those cooking while also preserving cultural heritage and foodways, and, you know, trying to make sure that people are that you're teaching them what they want to cook, what their family is familiar with, and what's culturally appropriate and right for them. How do we balance those things? I hear that come up a lot as a tension. Or even what a doctor might suggest, you know, that a patient eats. A patient comes in, the doctor says, well, you know, you should really eat this kale salad. That might be something that is not what the patient is going to eat.
No.
So how do we balance those tensions?
Well, I can actually tell a really funny kale salad story.
Okay.
When I was living in California, actually, we had these, and it will actually get to the broader question, I promise. But so we had we had a food as medicine booth at the farmer's market. We were basically kind of holding office hours at the farmer's market, and anybody could come up, but we also had this like food demo booth, and you know, we were making different foods, and we just sort of there was also someone who was helping with SNAP enrollment at the market. We were doing this once a month. There were like all kinds of other activities. We were really kind of trying to make it a fun, family-friendly event to be able to come to the market. But so, you know, we just sort of had, you know, something different every month that we had the recipes for. It was something that, you know, sort of had a SNAP budget in mind, and was all ingredients that was available at the market that day. And we were also working with this amazing organization with recently emancipated foster youth. And So we had them sort of working with us and like going out and sort of saying, you know, what do you think would like taste good in this, you know, frittata? Just like go out to the market and, you know, get stuff and we'll kind of throw it in, and kind of really thinking about what does it mean to kind of be able to improv with ingredients, kind of thinking about, you know, I've sort of talked with a lot of people where some people say, you give me a fruit or vegetable and I'll make it taste good. And other people are like, you give me a recipe that tells me exactly what I need to do with everything I need to have in it. And I know that when I show up at the farmer's market or the grocery store or whatever it is, they're gonna have everything I need, and I can afford it, and I've been able to taste it in advance and know that I like it and my kids will eat it, because I can't afford to make something that my kids are then not gonna refuse to eat, So sort of all of those conditions, like I'm totally down, but if I don't have one of those ingredients, then I'm totally flustered and I kind of don't know how to substitute. So I think that's like one thing, you know, that we can think about. But so we were kind of making this kale salad, and there was this sort of young woman who was helping us, and at first she was like, that's not even food. Like, that's a weed that grows in the yard, and you pull it out. And she like totally didn't want to touch it, and then we kind of made the kale salad, and then people got really excited about it, and actually then became this like demand that like every month, no matter what else we were making, we always had to have kale salad available. But so she kind of the first time like was so turned off by it, and then, you know, like the second or third time around, she was like, I've got this, like I'm gonna go over there and make it, you can like go do something else, which was just like really amazing to kind of see like these youth kind of take ownership. Like one of the kids actually went on to, he wants to become a chef, which was just pretty cool. So I think just sort of, you know, engaging people and kind of thinking, meeting people in the space that they're at. And I think in terms of, so not everybody's gonna like kale, but sometimes you might be surprised if you taste it. And I think really talking to people about what are the foods that they're making. And I think for all of us, you know, we have foods that there may be like, you know, traditional ways that like our, you know, our grandmothers or whoever sort of prepared foods that maybe by conventional nutrition standards aren't the healthiest, but potentially that there's ways that you can think about, you know, baking instead of frying as like one example, which is not always the answer, but sometimes is a conversation. So how can you take the meals that you already know and love and know your family likes and figure out ways to just tweak them a little bit so that maybe they're healthier? And I think another thing is like making sure that the foods people want are actually available. So thinking about community gardens and thinking about bringing people in. When I was in residency, we had a large Cambodian and Laotian refugee population, and they couldn't find the foods that they wanted at the grocery store. And so we actually had community gardens with a lot of people who had a lot of farming skills but didn't have land available. And then we were able to get the seeds for the vegetables that they wanted and weren't able to find. And these were incredibly flourishing gardens that then people were able to harvest and be able to make the foods that they wanted to make. So those are just a couple small.
Yeah, just grow it yourself.
And just a really quick add, another thing, in addition to those things, is making sure that there are diverse voices at the table and who are designing some of these programs. Because if you look at any ethnicity's traditional foods, you can pick out foods that are comparably nutritious.
Yep.
So I love kale, but collard greens are nutritionally comparable to kale. So if a person is used to eating collard greens, maybe looking at that, how can you use those? You're familiar with it already. What are some different recipes that we can use? I've taught classes like that, taking traditional foods and just preparing them a little more healthily, and not saying that you can't prepare it in a traditional way if you choose to, but here are some other options as well and ways to use them. And so I think when you acknowledge that food is not just nutrition, but it's community, it's memories, and you look at that and you respect a person's traditions and then start at that base, then it makes it a lot more palatable and people accept it better.
And also figuring out how to conversations about how the food still tastes good, because like when food becomes punishment, like we've like totally, we're doing something very wrong. So
The only thing I'll piggyback on, Winona mentioned who's included in the creation of those programs. So there's, Eastern Market runs a recipe card program. So when we've actually got now, some of our WIC participants are contributing recipes and information to come up with what are those recipes that are going to be shared around the community. So it's not just the chef that is at Easter Market, but it's people from the community.
Great. Okay, at this point, I have more questions, which I'll ask if the audience is quiet, but I bet you guys have a lot of questions too. So I want to open it up. We have about 20 minutes for some Q&A. So we have microphone runners. Yeah, in the gray sweater.
Thanks. Yeah. So I was curious. I feel like you guys got a really good overview of how food insecurity is kind of really common throughout the nation and throughout Michigan. But at the same time, sorry, I wrote this down because otherwise I forget what I want to say. So the median household income of a U of M undergrad is $150,000, and Michigan Medicine recently introduced this whole new healthcare plan that allows for personalized service and reduced waiting time, and I think the quote was preferential access to physicians. So you basically buy your way to better healthcare. And so it kind of strikes me that income inequality and a lack of nationalized healthcare is kind of a big thing that hasn't really come up. And I was wondering if maybe, in addition to all the issues you talked about, y'all could talk about that a little bit. I don't know.
Alicia, it might fall to you on that one.
I have many opinions on Victor's care. I'm not a fan. Yeah, I think it's incredibly problematic. I think it on many levels, I think that, and hopefully I'm not going to get in trouble for saying this, but I think that you're promoting a two-tiered system, and you're saying that money buys you access to quality health care, which I feel like is already sort of reinforced in the way our healthcare system is currently built. And so sort of for an institution to kind of then further codify that and say that, if you give X amount of money, that not only do you have access to sort of, a concierge doctor where it's one thing to kind of say, look, you'll have access to this person, you'll have their cell phone, you'll have sort of wait lines to get into an appointment. I think one thing that's really concerned me about the Victor's Care is that the implication is also that people will have faster access to specialty care, and faster they'll be able to jump the line in the emergency department. And to me, that's incredibly troubling. Yeah, I think it just further perpetuates a lot of, we're already trying to work with the existing disparities. And I think to, for further kind of perpetuate and enable that is something that I think has been really hard for a lot of us within the university and within Michigan Medicine, and is a pretty robust debate right now. So.
Thank you. You guys are welcome to comment too, but.
Yeah, I guess I can't comment on
That's
that.
fine.
I know there were widespread protests, though, so hopefully.
Okay. Go ahead.
I think so thinking about the healthcare system, so the majority of Detroit is considered a medically underserved area, which means residents do not have adequate access to primary care doctors, doctors' offices, et cetera. In thinking just about Alicia's study in the waiting room, there aren't that many waiting rooms in the city of Detroit to reach patients and tell them about fruits and vegetables. And we even we cold called 65 primary care facilities in the city, excluding hospitals, and just asked them what kind of nutrition staff, dietitians that they had. Only 20 out of those 65 said that they had one staff person at least that did that. And very often that one staff person was there once a week, once a month, half a day, here and there. Broadly, the healthcare system in Detroit is balanced on kind of 3 major hospitals. And after that, it's really difficult.
And then with nutrition services, not many things. So dietitians are generally looked at as overhead in a hospital or in a lot of clinical settings. And so you can't see one until you are already in a disease state. So you can't see a dietitian and have it paid for through your medical healthcare benefits generally until you are already have diabetes, not to avoid diabetes. You already have heart disease, not to avoid heart disease. And then obesity, it had to be, when I was in a clinical setting, it had to be, at that time we called it morbid obesity or obesity 2 or 3. So it wasn't even just overweight or obese and I see you're headed there. It had to be where it was, you were in a medical emergency. So.
Can you share the part about when you had to consult right after the
yeah.
surgery?
So all dietitians have to work in a clinical setting, and we had to deliver our heart healthy diet information within 24 hours of a person having heart surgery. So if you've ever tried to talk to somebody who just had their chest cracked open, you're not getting much information in, basically. You know what I mean? It was like, just heal, So, and that's not effective, but that is what was required, so.
Great. Okay, more questions. And I see that at least one came over Twitter, but we'll see who else has questions here. Okay.
Hi. When thinking about like food policy, one issue that really intrigues me is things like sugar taxes. I was just wondering, I know it's a controversial topic because it's seen as like limiting personal choice and freedom, and especially affects people of low socioeconomic status. So given your expertise and backgrounds, I was wondering your opinions on things like that.
All right. Who wants to take that?
So I'll start with that one. So in Michigan, it's my understanding, and I'm not an expert on taxes, but it's my understanding that it can't be done at a local level. There's some issues with that. It would have to be at a state level. I've seen it done well in different localities, and then I've seen it done not so well. The thing that I'm always concerned about is putting another stick in place for a person who is struggling with low income, because of what I talked about, right? So the things that are subsidized are those foods that aren't as healthy, and then you're putting a stick in that. But then I've seen where those taxes have come back and really helped the community, and it's helped the community improve. So it really has to be done very well, very intentionally, and the community has to be involved in shaping anything like that if it were to come into play.
Great.
I couldn't have said it any better.
I agree.
Thanks. All right, more questions.
So I know that we talk a lot about health problems that are associated with poor access to fresh foods. And so we talk a lot about diabetes, obesity, heart disease. I was just wondering where dental caries and cavities and oral health fall into that realm, and then how that can become more of a discussion moving forth. I think it has a pretty strong impact. Thanks.
I think it's a great question, and I think it's not one that we talk about a lot. For sure, I mean, thinking about, obviously if you're talking about like, fruits and vegetables versus like sugar-sweetened beverages and sort of what that will do in terms of oral health, and I think also thinking about, what our children have access to. I think another issue that kind of further compounds it is sort of getting back to healthcare access. And how many people don't have access to dental care. And even though technically for children with Medicaid, they have access to dental care, I can tell you that when I talk to somebody and I actually hand them the list of dental providers who accept Medicaid, none of them are taking new patients. I think that it's sort of like both of those pieces that are really critical. And when we think about more and more evidence is coming out about the ways in which oral health can impact inflammation, can lead to, premature delivery and birth complications, can worsen all kinds of chronic health conditions. And you hear about people who can't afford to go to the dentist, and so instead they end up at their, primary care doctor's office or at the emergency room with an abscess. And so then you're just kind of clearly the tooth needs to get pulled, but they can't get into somebody who can actually pull the tooth. So then you're just giving somebody antibiotics to kind of help quell the infection, but you're not actually addressing the underlying problem. And then, surprisingly, people then end up like a couple months later with the same abscess that's reflared. And so I think that, sorry, I know that's getting a little bit away from sort of like how the specific foods, but I think it's all interrelated, because I think that if we're not nourishing our bodies, that impacts our ability to care for sort of like all of our health, including our oral health. Certainly there are foods that will make, that can exacerbate underlying oral health conditions. And then when people can't get access to basic preventative care or to services they need when there are problems that arise, it just sort of compounds everything, so.
And dietitians, when we do a nutrition assessment, that is one of the things that we look at. But again, it's, then what do you do about it if you don't have access to healthcare? But we look at that to look at what type of healthy foods you can eat. So I'm not going to tell you to eat a whole apple if you are having dental issues. I'm going to try to think of something else that is nutritious that you can eat, you know, with your dental problems, and hopefully you can get them taken care of. But as you said, there's problems with that.
Okay, I see a hand in the middle here, in the black sweater.
This is a lot. Okay. There's a lot of talk about like increasing food access in Detroit specifically, and like with the new Whole Foods market in Midtown. My question is, how is gentrification affecting food access among the whole city of Detroit?
So I don't know how gentrification is actually, I mean, so you see areas that are gentrifying have more options. So that would be how it may be affecting it. But other parts of Detroit, so as Alex talked about earlier, and I was sharing I live in the city of Detroit, and I was sharing a issue that came up with me, and just the type of service you get as well. So, you know, in some of the areas, residents aren't treated like they are customers, or like they have choice, or, you know, or as if their business is valued. So that is just as much of an issue as anything else, and that's one of the things that we're looking at. So, you know, in areas where it's gentrifying, you do see more options, but we want to make sure that throughout the city, there are options that treat people with respect and provide the things that people need. And so that's part of our work.
Yeah, and I'd say it's difficult to say that just the construction of Whole Foods altered Detroit is a huge place. Right. And so actually the only people that I had found that started using Whole Foods as one of their food access points was people that were just on the near east side. Otherwise, no one mentioned Whole Foods as an option that they went to. So if you lived in Northwest Detroit, where there's population density, or if you lived in Far East Detroit, where there's more population density, those people were not going to Whole Foods. Whole Foods did nothing to change their food access. And I think in the same way, you know, Whole Foods actually located itself in Midtown Detroit, which actually already had a density of grocery stores. Independent, full-line grocery stores. So I think there's at least 3 other grocery stores in a 1-mile radius of Whole Foods. But Whole Foods was able to take advantage of new market tax credits from the federal government because of food desert designations. So, I mean, in those ways, you know, people are able to take advantage of larger programs to improve their own market share.
We haven't had any questions over here. Anyone got anything? Oh, here, I see a hand right here. Red sweater here.
Hi, so one of the great things about this class and about this lecture series is that there's a whole diversity of people here. And one aspect of that is that a lot of us are dedicating our lives to food and how it affects health and policy and sustainability, but a lot of us are not, myself included, and I've picked up a lot on how this affects my own life, especially in terms of health, but I'd like to learn a little bit more about how people who are not dedicating their lives to this can contribute on a systemic level. So, what are some like small, accessible ways that people who are not dedicating their lives to food can help or contribute, both from a student perspective and maybe a non-student perspective? Thanks.
So one way is by the way you spend your dollars. So supporting things that are sustainable, and I know that's a big word, but looking for ways to support, to show your values and living your values. And then also, when I look at our work, so we're a nonprofit, most people tend to give to organizations that work on a level of giving things now, but even supporting organizations that are working on systematic work. So looking for that, and when I say support, it could be volunteering or donating or even talking about and bringing awareness about it and spreading it in that way.
I think also thinking about your place of work and what types of foods are available there is another way to engage. Winona gave some good examples thinking about what foods were available in the IT sector. I think everyone eats. So figure out where your own interactions with food are, and are they the interactions that you want, or do you want those to be different? Do you want to have healthy vending in your office building, or do you not care? You'd rather have chips and candy. And I mean, I'd also say, we talk a lot about food culture, but there are obvious, broad categories of food culture, but think about your own personal food culture. I would argue that even individual families have their own food cultures that come about. And I know my wife and I debated many things about how we were going to prepare certain recipes because our families did it differently.
Yeah, I mean, I think kind of thinking about your food environment and kind of how you're voting with your dollars, and even thinking like as a student at U of M, I think U of M has done a lot of really, there's a Sustainable Food Systems Initiative. I think, U of M is doing a pretty remarkable job, but kind of thinking about your environment and, if you see something that you're not okay with, sort of raising your voice and thinking about how to change it. Another thing I think about, though, is how you vote at the ballot box. And sort of what that means for local elections, for state elections, for national elections, and kind of thinking, big picture, like what does this mean in terms of the Farm Bill, and, kind of ways that you can get involved. And even if, you're not sort of saying this is my life's passion, if there's like a particular issue that you want to get involved with, sort of educating yourself and seeing if there's ways to locally help try to, how to shift change, shift policy, and it could be, like attending meetings and kind of just educating yourself more. There's kind of all kinds of ways, but I feel like there's definitely opportunities on a legislative level or on a policy level where you can kind of, dip in for like a particular issue without having to feel like you need to like, take on like eating the entire elephant. So.
Oh yeah, and you were going to ask, how many people have been to a farmer's market? Oh, wow,
Ooh.
that's awesome. Cool.
Well done.
Great. Okay, we're just about 8 o'clock, so please join me in thanking our panelists.